Assalamu alaikum. Hello everyone. Hope you all are well. Today is our academical session and we are going to discuss about a very important topic. This is how respiration affects the hemodynamics. Okay, so let's get started. During the respiration process, there is two things we all know that this is inspiration and expiration. There are two phases. Okay, so let's get started with inspiration. So what happens during inspiration? We know that the inspiration, that means the air will move from the outward to the in of your body, that means to your lungs. So for that reason, your intrathoracic pressure should be decreased. Why? Because air tends to move from the high pressure side to the low pressure side. That's why your intrathoracic pressure will decrease. Okay, then when your intrathoracic pressure will decrease, it will causes the blood flow to push easily, and this will cause the more venous return to the right atrium. So there will increase venous return to right atrium, and for that reason there increase venous return, and the right atrium will cause systole, and the blood will go to move to right ventricle, and from the right ventricle it will go to lungs, and this causes the more blood pumping to the lungs. Why? Because during inspiration we get oxygen from the air, and we want that all our blood should be oxygenated. So for that reason we want more blood to be pumped into the lungs. That's why there is more blood pumping into the lungs. Okay, so when more blood is pumped into the lungs, then what happens? At first there is decreased blood in the right atrium. So when there is decreased blood in the right atrium, there is less amount of blood in the right atrium, then it will cause decrease of JVP, because we know that the jugular venous pressure depends on the pressure of the right atrium. It indicates the pressure of the right atrium. Okay, so when your right atrium is empty, it will automatically cause the decrease of jugular venous pressure. Okay, and also see that in the inspiratory phase the lungs are filled with oxygen, and they are highly capacitant, and they will cause a large amount of blood to be pulled inside them, and this causes less venous return to the left atrium also. So there will be decreased venous return to the left atrium. Okay, so when there is decreased venous return to the left atrium, what will it cause? So decreased venous return in the left atrium causes decreased blood going to left ventricle. So there is left blood for left ventricle. Okay, so it will decrease the preload of the left ventricle. Okay, because the amount of the blood is less, and when there is decreased preload in the left ventricle, decreased blood amount in the left ventricle, the stroke volume will be high or less? It will be less. So there is decreased stroke volume also. And we know that the cardiac output depends on stroke volume into heart rate. So in order to maintain the cardiac output, when there is a decrease in stroke volume, you must increase your heart rate. So as a result, during the inspiration phase, our heart rate increases. But it is said that the increased heart rate causes the increase of cardiac output, but it cannot maintain the pace with the blood pressure, because the blood pressure is maintained by cardiac output into total peripheral resistance. So though the heart rate is increased, but overall the blood pressure is decreased because the stroke volume is much less. Okay, so there is decreased blood pressure due to decreased stroke volume. Okay, so decreased blood pressure due to decreased stroke volume. That's an important matter. So what we have learned, that during the inspiratory phase the JVP decreases, the stroke volume decreases, the heart rate increases, and the blood pressure decreases. Also there is another component. See that during the inspiratory phase the right heart actually works more, because it actually pumps all the blood to the lungs. So for that reason the left heart works kind of less, and that's why your aortic valve will close faster. Okay, so which sound you will get first, aortic or pulmonary? Okay, we will get the A2 sound first, that is aortic component of the heart sound is found faster. Okay, so A2 sound is heard first, and after that the pulmonary sound is heard. Okay, and that's why there is a splitting of the second heart sound, because we know that the second heart sound comprises of two things. One is aortic sound and another is pulmonary sound. So when the aortic valve closes early, it causes the splitting of the second heart sound. So there will be splitting of second heart sound. Okay, that's all about inspiration. So let's again rewind what we have done. So we have said that during inspiration there is decrease in JVP, decrease in blood pressure, decrease in stroke volume, increased heart rate, and splitting of JVP, splitting of second heart sound. Sorry. Okay, so what happens during expiration? Okay, let's talk about the expiration. During the expiratory phase, all that we have talked earlier, it just reverses. So all that we have found, it just reverses. So there will be increase in the JVP, increase of blood pressure, increase of stroke volume, decrease of the heart rate or normalization of the heart rate, and fusion of the second heart sound. But we will explain it to you. So how can it happen? So at first, during expiratory phase, the lung shrinks and it causes the pulling of the blood to go into the left heart. So there is more blood to the left heart because now the oxygenated blood need to be pumped to the all over the body. That's why there is more venous return into the left heart, more venous return from pulmonary vein to left heart. So when your left atrium is filled with oxygenated blood, it will drain into the left ventricle. Okay, so there is more stroke volume in left ventricle. So when the stroke volume will increase, it will cause increased cardiac output, because the cardiac output depends on heart rate and stroke volume. So there is a increased stroke volume, so it will causes the decreased heart rate. Okay, and the cardiac output, as a result, the stroke volume is highly increasing and it causes the increased cardiac output. Okay, and also the fusion of the second heart sound how occurs? Because here the left heart is working fast, so the pulmonary valves closes first, and the pulmonary component of the heart sound and the aortic component of the heart sound both are present simultaneously, and that's why there is fusion of the A2 and P2 sound. Okay, A2 and P2 sound both fuses together. Okay, so we have found out the most important causes, and there is another exception, another pathology regarding the hemodynamics of the respiratory system. Let's talk about that. Suppose you have COPD or any lung disease that causes obstructions or that increases the pulmonary pressure, that causes pulmonary hypertension, or you have cardiac tamponade. So what will happen then? So during cardiac tamponade, there is fluid or something like that in your pericardium. Okay, so it restricts how will your heart pump, and it restricts your heart dilatation, and it causes the normalization of the pressure all over the cardiac chambers. Suppose during systole, we know that the right heart, there is increased venous return in the right heart, and from the right heart it will go to the right ventricle and then to the lungs. Okay, so when there is more venous return to the right heart, it will causes the deviation of the atrium septum to the left. And suppose the atrium septum is deviated to the left and there is less space for the left atrium to be dilated, and so there is much less space in the left atrium, and this will cause much fall of cardiac output, much fall of stroke volume. Okay, so the resulting, and when the cardiac output is decreased, this will also causes much fall of the blood pressure. So we know that there is decreased blood pressure during inspiration, but when it is more than 10 millimeter mercury, it will cause another sign. There is known as Kussmaul sign, and this kind of pulse is known as pulsus paradoxus. Okay, so we find pulsus paradoxus and Kussmaul sign. Okay, so how the Kussmaul sign is found? So Kussmaul sign is a sign which causes that the increase of JVP during inspiration. So you are in inspiration, but your JVP is increasing rather than decreasing. So how it will happen? So think that this is your heart, and from that heart you will pump your blood to the lungs. Okay, so this is your lungs. Okay, So if there is pulmonary hypertension in the lungs, can your right ventricle pump properly? No, it can. So there is much pressure gradient from the right ventricle to the lungs, and for that the right ventricle can't pump properly. So when your right ventricle cannot pump properly, the blood will accumulate in the right ventricle, okay, and from then the blood will accumulate in the right atrium. So in a sense, the right atrial blood is more and there is less space for more blood coming, and as a result there is increased pressure in the right atrium. And increased pressure in the right atrium, we know that when there is increased pressure in the right atrium, it will causes increased jugular venous pressure. So that's why paradoxically in inspiration, though there is chance of decreased JVP, but in that case there will be increased JVP will be found, and this is known as Kussmaul sign. So we have already learned that the pulsus paradoxus and Kussmaul sign, and they can be present in case of cardiac tamponade, in case of chronic obstructive pulmonary diseases which may cause pulmonary hypertension. Okay, so that's all for today. This is the main hemodynamic response for respiration, and let's summarize in 2 seconds. Okay, so first of all, we have said there is two phases, inspiration and expiration, and we have also learned some basic mechanism about that. Okay, so what are actually happen there? Number one, heart rate. Think that heart rate during inspiration increases and during expiration decreases. Cardiac output decreases and expiration increases. Blood pressure, in inspiration it decreases, expiration it increases. But when the blood pressure is changed about more than 10, it is known as Kussmaul sign. It is known as pulsus paradoxus. Okay, and Kussmaul sign is mainly with the presence of JVP, that increased JVP during inspiration. But usually the JVP is decreased during inspiration and increased during expiration. Okay, so that's all for today. Thank you for watching the video, and please know about your suggestion and which topic you want to like that we will explain. Okay, thank you. Assalamu alaikum. Allah Hafiz.